evening from New York. While he was being heckled by the tea bags at a town hall, Lindsey Graham asked rhetorically, how many senators are there? A few of the protesters murmured, 100? Most seemed to have no idea. He then asked how many were Republican senators. Even fewer answered, 40? Even more seem to have no idea. Our fifth story in the countdown, that seems to be the problem not only in South Carolina, where the minority party does not seem to realize it is the minority, but also in Washington, where the majority party does not seem to realize it is the majority. Filibuster is the informal term for any attempt to block or delay Senate action on a bill by debating it at length. Cloture is a motion or process aimed at bringing debate to an end, requiring the votes of 3/5 of the full Senate, normally 60 votes. Thus, Republicans cannot by themselves filibuster health care reform. Democrats have to collaborate, collude, cave. Day 2 of meetings in Majority Leader Reid's office to merge the Senate finance bill with the more liberal version approved by the Health, Education, Labor, and Pensions Committee. Senator Reid's office now trying to put the toothpaste back into the tube after reports yesterday that the Majority Leader had given Senator Snowe a seat at the table. An anonymous aide to Senator Reid today saying of the main Republican, quote, she will not be at the table. The only people who will be at the negotiating table are Harry Reid, Max Baucus, Senator Chris Dodd, and the White House. Which isn't quite the same thing as saying the Majority Leader will be vigorously pursuing the public option. Meanwhile, Speaker Pelosi today reiterating that the House will approve the public option, adding that in addition, lawmakers there are now considering a $6.7 billion a year fee on the insurance companies. Speaker Pelosi saying recent attacks by the insurance industry, the cartel, have erased any doubts that substantial reform is necessary. The industry out with a new attack on legislation. Of course it is. It's a day of the week ending in Y. Now claiming that the Baucus bill would mean higher insurance premiums for individuals and small business, thus driving down the number of small employers who would offer coverage. This report was conducted by Arthur Andersen and paid for by Blue Cross Blue Shield. On Monday, PricewaterhouseCoopers having released its study that was funded by the entire industry's lobbying arm, AHIP. Even Senator Grassley of Iowa, death paneling, the one part of the Baucus bill that the insurance industry actually likes, mandated coverage for everyone with no pesky public option to provide competition, paid for in part at government subsidy expense. The Iowa Republican calling individual mandates unconstitutional in violation of the 10th Amendment.
This is the first time in the 225-year history of our country that we have forced you as a constituent, any of our constituents, to buy a product. You know, you've been free to buy or not buy, but now for the first time you're going to have to buy health insurance. I'm not a lawyer, but let me tell you, I've listened to some lawyers speak on this, and you know, it's a relatively new issue, and I don't think we've ever had this issue before of having to buy something, and a lot of constitutional lawyers are saying it is unconstitutional, or at least a violation of the 10th Amendment. Now, maybe states could do this, but can the federal government do it? So I have my doubts.
You heard of insurance on cars, Senator Grassley? Mandatory insurance on cars? Meanwhile, Senator Mary Landrieu of Louisiana, believed to be one of the conservative Democrats, now threatening to filibuster. We would not know for sure. The Majority Leader is keeping that information secret. She did nothing to dispel misperceptions about the public option after our own Tamron Hall asked the senator why she thought the public option was so popular in the polls.
Do you believe in that desire from the folks that you and all of the others represent who say that they would like a public option to help offset these costs?
I think when people hear public option, they hear free health care. Everybody wants free health care. Everybody wants health care they don't have to pay for. The problem is that we as governments and business have to pick up the tab, and as individuals. So I'm not at all surprised that the public option's been sold as free health care, but there is no free lunch.
Time now to call in Congressman Anthony Weiner, the Democrat of New York. Thank you again for some of your time tonight, sir.
Thank you.
Senator Landrieu said the public option is being sold as a free lunch. The president was very clear. It's not a free lunch. The public option is a self-sufficient, self-sustaining enterprise paid for solely by premiums out of the system and into the system. So who other than those who are dedicated to destroying the public option has tried to sell it as free health care?
Well, as a matter of fact, the American people are supporting the public option because despite what the health insurance industry and some senators think, the American people understand they want additional choices. You know, I created this website, countdowntohealthcare.com, thinking I would use the petitions I gathered to lobby my Republican friends. I seem to need it much more with some of my Democratic friends because, frankly, there's more misinformation being spread out there, and it's not just people like Chuck Grassley, who I got to tell you is one fry short of a Happy Meal if he thinks that Congress can't do this. But it's a lot of my moderate Democratic friends are turning out to be our biggest headache here because they don't seem to understand this proposal very well at all.
I already like that name of your website, countdowntohealthcare.com. How are you using it to tilt against these reluctant Democrats?
Well, I just want to tell you I checked. I didn't step on your trademark much. Look, we have over 30,000 people, and when we started looking at the zip codes these people are signing up saying we want a public option at countdowntohealthcare.com, a lot of them were from these so-called swing districts. Despite the mythology, it is these citizens who voted for Democrats because we said we were going to fix health care. Now these very same representatives are running for the hills claiming their constituents don't want it. I think the American people want alternatives. And the health care industry over the last several days has done exactly what they hardly ever do, told the truth. They've been saying they're going to raise rates. They're saying it loud and clear. They're begging for us to include competition in this bill. And if we don't do it now, we only have ourselves to blame.
And we also, during this bizarre week, found out, many of us, to the surprise of many of us certainly, that the antitrust exemption is firmly intact. It and Major League Baseball have this, and that's it. Is it amazing to you that we're still having a conversation about whether or not it's a good idea to rein these companies in?
Well, you know, the health care industry takes home every year in the neighborhood of $200 billion in profits and overhead. That's money that doesn't go into a checkup, it doesn't go into Operate Endo, and it doesn't get us any health care at all. It is remarkable to me that we have the Republican Party, a wholly owned subsidiary of the insurance industry, teaming up with a small group of Democrats to try to protect that industry. I just don't get it. And sooner or later, the American people are going to weigh in and say, enough is enough. I'm glad Nancy Pelosi is hanging in there as tough as she is.
About Senator Snowe at the negotiating table, whether she is there or not, the story has changed in the last 2 days. Does it seem evident to you that enough Democrats in the Senate and maybe enough Democrats in the White House have all but given up on the public option or are ready to, unless they are backstopped in some way?
I don't think so, and I hope not. You know, I think that, frankly, if you don't have a public option, I don't think you can pass a bill out of the House. And I think that the White House gets that. You know, at a certain point, President Obama has to put his finger on the scale here and say we need to have a public option. I at least give Senator Snowe the credit for seeming to be engaging in a serious debate. When you see Chuck Grassley pulling these bizarre constitutional theories out of, I'll leave it to your viewers to imagine where he's taking them from. But, I mean, you really do see how bankrupt a lot of this debate has become. At least Senator Snowe is trying. But this bill, if it does not have a public option, not only will it not save money, but I don't think it becomes law.
Congressman Anthony Weiner, the Democrat of New York, once again, great thanks for your work on this and for your time tonight.
And for countdowntohealthcare.com.
Excellent.
Thanks.
No impingement there whatsoever. Thank you.